program team, and also our city, as well our government. For the hard work and made possible this historic first ever COVID-19 vaccination program here at Quezon City General Hospital. Salamat at mabuhay po tayong lahat. So for this momentous occasion, I'm privileged to introduce to you our guest speaker. She is in the primary work vaccination program. Woman leads by example. We are grateful for all that she has done for the city, most especially in our hospital. And so, please join me in welcoming our beloved City Mayor, Honorable Maria Josefina Belmonte Alimorong.
Please take your seats, ladies and gentlemen. Good morning to everyone.
Good morning.
Good morning at isang magandang araw sa atin. Gusto ko muna pong magbigay pugay sa ating pong hospital director, si Dr. Josephine Katukayo ko sa Bando. Binabati ko rin nandito si Dr. Akong ng MDH. Si Dr. Arias, ang ating pong City Health Head. Nandito rin po si Mr. Joseph Wico, ang head ng ating task force Back to Normal. Si Mr. Perry, yes, nandito rin po. At si Dr. Maki, ayan, ang kampiyon natin sa quarantine. I just want to, first and foremost, gusto ko lang po magpasalamat sa lahat ng mga naandito ngayon, ng mga healthcare workers natin, mga frontliners natin, lalong-lalo na yung mga magpapabakuna ngayong araw na ito at sa mga susunod na araw. Yung mga nagbigay ng bakuna sa site. Kung po ang nagawin ito para po sa ating lungsod. Totoo po yung sinabi ni Dr. Sabando, medyo masama ang loob ko sa inyo nung bakit po? Linggo-linggo po kami nag-meeting ng mga mayor ng Metro Manila, kasama ng DOH, etc. At nagiging transparent naman po yung DOH sa pagsabi nila sa amin na ito yung sitwasyon natin, na 90% ng lahat ng mga bakunang gusto ninyo ay nakuha na ng mga first world countries, 10% talaga natin naiiwan for the rest of the world. Yesterday, I was in an embassy meeting with an ambassador from a first world country about Women's Month affairs, and he admitted to me that they have purchased 3 times the vaccines that their population needed, or they, purchased, is the right word. No? And sabi niya, pero don't worry, kasi pag nabakunahan na kaming lahat at may extra, ipapadala naman namin sa mga mahihirap na bansa. So, sabi ko, kailan pa yun, di ba? Kung hihintayin pa natin yung mga bansang ito na magtapos, tapos yung tira nila, ibibigay nila sa atin. Sometimes, meron tayong mga pinapangarap. Pinapangarap natin magkaroon ng Apple computer o iPad, nabigyan ng tayo ni nanay ng Huawei. Minsan, gusto natin, meron tayong BMW, ang nabigay sa atin, Honda. Multicam pa nga minsan. Pero at the end of the day, pareho lang naman ang function eh. Makakarating naman din tayo sa karoroonan natin, di ba? Pero ang masakit kasi kung naghintay ka para sa BM mo, sa BMW mo, o kaya sa Mercedes-Benz mo, baka it's too late. And sometimes timing is everything. And I think this is a situation where timing is everything. Because kung wala tayong COVID cases, kung isa, dalawa lang a day, by all means, sasabihin ko, hintayin natin, dumating yung hinihintay na West much higher than we would have wanted. And in fact, this afternoon at 1 o'clock, the Metro Manila mayors have an emergency meeting because the South African variant is here. The UK variant, they discovered another how many cases of that, and it's here in Metro Manila. And you know how mobile we are here, how much we engage with one another here. And so, no matter how much we try to be careful, tataas at tataas ang mga bilang natin. And I feel very proud of Dr. Sabando and the rest of you because I really made an appeal to Dr. Sabando that hindi pwedeng hindi tayo magpabakuna. Hindi pwede talaga na hindi natin tanggapin yung inaalok sa atin. Kasi una sa lahat, alam ko marami naman sa atin ay ayaw dahil made in China. No? And I think that you are all scientists kasi ang taas ng pinag-aralan niyo dahil nurses kayo, doktor naman kayo eh. Alam naman natin na our judgments should not be clouded by our biases eh. They should be based on scientific evidence. No? And I'm so happy that Dr. Sabando, I just want to congratulate you that you took that effort to look at the science behind the drug. That you did not allow your personal biases against China for whatever reason you may have. Siguro mabilis nasira yung binili mong Christmas tree from China. Kasi yan yung nangyari sa akin, yung Christmas tree na nabili ko from China, nasira na. Pero iba naman yung vaccine. And you studied the science behind it. And you saw that scientifically it is safe and it is effective. And in fact, this may be true or not true. This is hearsay. Kwento lang sa amin ni Joseph nung nandun kami sa isang hospital, may doktor na nagsabi. Yung 50% na yan galing lang naman sa studies ng Brazil. But it's really because what they did in Brazil is during the height of the pandemic in Brazil, ay ang ginawa nila, lahat ng healthcare worker, yun yung ginawang trial nila, trial 3 nila. Pero pagkatapos babakunahan, remember that it takes a few weeks for the vaccine to really take full effect. Sabak agad sila sa COVID ICU, no, without having allowed the vaccine to take its course to produce antibodies. Yan yung sinabi sa akin ng isang doktor. And therefore, yan yung naging outcome. And given that situation, a very high-risk group, sabak ka agad after vaccination, and yet it was still 50% effective. Already for me, a positive sign. Because no other pharma company, I think, did that, na lahat ng tinest nila ay high-risk healthcare workers. We do not know that itong mga pinagpipitaganan nating mga bakuna na pinapangarap natin, we don't know if they would have the same effect because it was not done. No, that kind of study was not done. No. And so, I do not have that bias kasi against Chinese medicines kasi because I grew up na you set aside your biases sa China as a country for whatever reason and just looked at the science behind it. And remember that China, hindi naman sila mga masasabi nating inferior scientists sila. In fact, when I was studying abroad in Western country, kasi lahat ng mga process na dapat napupunta sa mga Western students na occupy na mga Chinese students. Kasi they also get their knowledge from abroad. They also study abroad. But the difference is the best and the brightest are the ones that are sent in other countries. Kasi binabayaran yan ng ibang mga, ng government nila. So, when my husband was in Stanford, siguro kalahati ng mga classmate niya taga-China. But these were the best Chinese students studying in the Western world. When they bring back China, as they are required to do, they are not supposed to stay in China because the government pays for them. I'm sure they apply also what they have learned in their own countries. No? So, ang sinabi, a little bit emotional, why? You know why? I'm not a doctor, I'm a politician, but I'm also the leader of this city, and it is in my power to protect you. It's in my power to protect you, and if I don't do everything that I can to convince you to protect yourselves, if something happens to you, you get severely ill, or one of you dies, your blood is in my hands. That's how I see it. No? okay, the accountability was in the hands of the president as the leader. Remember that, no? So if Dr. Sabando, if I was very, very emotional about you not wanting to be vaccinated because you wanted to wait, and if something happened to you while these new variants are coming in and you're still wanting to wait, the guilt will be in my conscience, your blood will be in my hands, and I will forever not be able to tell myself that I serve the people of Quezon City sincerely and honestly and with all of my heart, because this is something that could have been avoided. And so today, I'm very happy that many of you agreed to this vaccine, okay? Because now that sabi nga ni Dr. Sabando, truck na nang pumapasok na COVID patient, truck na po yan. Okay, at least you know that you are safe and protected. And at least you know that you are safe and protected by a drug that scientifically is effective. Okay, and if you are still worried and you're thinking na hindi kayo pinapahalagan dahil Sinovac ang binigay sa inyo, now I just read in the papers 45 countries are already using Sinovac. Last 2 days ago, we were in Lung Center, Secretary Duque said 33 countries, but now I think there are about 45 countries. If not Sinovac, Chinese vaccines like Sinopharm and others. Countries na katulad din sa atin, umasa sana sa isang first world country medicine or drug, pero dahil hindi tayo nakakuha, dahil nga nasa kanila lahat, ay nag-Sinovac na lang. Kasama dyan pati Singapore, ha? Kala nyo yung Singapore, hindi. But Singapore already placed an order for Sinovac. Hong Kong already is using Sinovac. Malaysia has already started vaccinating with Sinovac. No? Thailand is using Sinovac. Indonesia is using Sinovac. Countries in Latin America like Uruguay, Argentina, etc., they're using Sinovac already. And some European countries, yung mga wala sa elite, yung mga non-elite European countries, they're also using Sinovac. No? So, hindi naman tayo nag-iisa dito. Marami naman ding gumagamit ng Sinovac. No? And sometimes it's really just politics also between the West and the East, which is what is creating the biases. Because alam naman natin, may politika rin yan, yung West at saka yung East. At minsan, kung nadi-demonize lahat ng nasa galing sa East, you have to also think to yourselves, totoo ba ito o ito ay gawa-gawa lang na kwento, no? And that's why I thank you for choosing science, choosing the truth, choosing to probe more, choosing to ask more questions before jumping to conclusions, and there probably risk lives of your loved ones and yourselves and your. Thank you, CGH. I really can be vaccinated, I will be the first among you. I will be the first among you. Secretary Duque told me in the Lung Center when I was with him, he told me, if you get yourself vaccinated, you are depriving a healthcare worker of a vaccine. And there are so many, and the supply is so limited. So fall in line and stay in your line. Yan ang sinabi ni Secretary Duque sa akin. But in my heart of hearts, I told him, if for some reason you need me to be vaccinated, increase vaccine confidence, I am ready and willing to answer the call of duty. And so I thank you for answering the call of duty. I thank you for answering that call that all servants are called to do, which is to answer to the needs of our country when we are needed the most. And this is the time that we are needed the most. So thank you very much and God bless you. Let's all have a wonderful day. I think this is a day of celebration. Okay, so let's celebrate because you, our healthcare workers, are safe, and I'm now confident na kahit na 2 truck pa ng COVID positive ang dumating, at least dito sa Quezon City General Hospital ay mga men of steel na tayo, para na tayong supermen and women, hindi tatalaban ng virus at kayang-kaya natin i-overcome lahat ng mga challenges na dulot ng virus na ito. We will prevail, we will overcome, and we will succeed. Maraming salamat, isang magandang umaga sa ating lahat.
Thank you very much, our Honorable Mayor Del Monte. As they say, everything comes to an end. For closing remarks, may I call on the Quezon City Project Manager for Community-Based Testing and Co-Chair of Back to Normal Quezon City Vaccine Program, Honorable Joseph Hugo.
Good morning, everyone. Mayor Joy, Dr. Sabando, Dr. Aria, Dr. Mamu, Dr. Hilaria, everybody, good morning. Well, this is definitely a momentous occasion. No? Siguro next week, it will be more or less the first anniversary of lockdown. I remember March 19, when we first opened the first ever Hope facility. It was myself, Dr. Arias, Dr. Mamu, Doc Rolly, with the mayor. We were looking for a place to store all those people who are COVID positive. For me, those were the darkest times. No? At the start of COVID, Mayor and I would look at each other. Are we in a movie? Is this real, what we're facing? So we had to we get people tested. Wala naman tayong PCR test. So we have to look for partners to test people because that's the best way for us to quarantine them the minute they're tested. So we found a way with the help of Sir Doc Roddy, everybody, the mayor, talagang it was all hands on deck. Perry, who heads our investments, became a cameraman kasi walang tao sa PISD office. Dahil hindi makapasok, but he had to double hack. So everybody was multitasking. And then now, ito naman yung bakuna. I think nag-full circle na eh. We are now in the curing stages. So I'm very happy, and for sure all the health professionals, the mayor, and everyone, that you answer the call of duty. And to be honest, if I could be vaccinated kaagad with you guys, I would also join the mayor. Because that's one way of me protecting my family. Because during that time, the height of COVID, siguro for about 5-6 months, I couldn't even go close to my wife, to my daughter, had to stay in a separate room. All the more when we became positive, I became positive, ganun din. So, grabe na rin yung pagtitiis. And to see that there are 300 more or less people who are willing to be vaccinated, that gives us all hope. So, hindi ko napapahabain na. Gusto ko na mag-protect todo ang mga tao dito, so let's do it. So thank you.
That's our program for today, and this is Edgar Otero, your host. Thank you very much. Kaya halina at tayo. Everybody.
Mag-profession ako.
Amador, the Department Chair of Education.
Dito na ako Di ba bala ko papasok ng pasyente? Meron na. Oo, sige, pandor mo. Mamaya pa yun. Si Leslie, nasabihan ko si Leslie. Para doon sumama yun. Parang hindi siya nag-charge, no? Oo, baka mag- Sige, sige. Boss, sila nga pagdating ng mga dito, pwede. Tayo na naman. Pangin. Ayaw ba ako tabi? Ikaw pa gusto ko. Dito ako na sa pwesto ko. Para maganda yung ano eh. Kayo. Okay na. Ayan, okay na. Hindi.
Paki-endorse si
Upo na sila.
Ito na lang muna. Pero dyan mo na itan. Excuse me.
Huwag naman kayong daanan lang sa harapan. Mag-shoot na. Daanan sa harapan. Mag-shoot na. Yun, no? Sige. Yung huli. Baba ka ng konti okay. Konti pa. O sige, kuha ka muna. Dito ka kaya pa Ayan. Ayan. Yung mataba. Yung mataba. Kaya atras ka ng konti. Nakalive ako Hindi, atras ka ng konti dito. Sige pa. Kita yung ulo mo. Yan. Sandali Wait lang. Yan, ganyan. Okay na yan.
Sabihin niyo ako pag nasasanda kayo.
Sadya ka lang.
Bawal kong alawin.
Kaya si Diyos, kita yung ulo Nakalive ko nakalive.
At least ako maliit lang. Angkad
Nakad kasi ni Diyos
Sorry.
Huwag niyo harangan niya camera, nakalive yan.
Namuko ko nung
binigyan ko na kayo na upuan ha. Huwag yung gagawin yung tripod dyan ha. Masasagi.
Dapat ano muna siya, kunyari parang toto muna, tapos isa.
Teka lang, sabihin natin kaya.
Sabihan mo na, baka magsabay-sabay niya, wala tayong detalye.
Papoto, kung muna yung turok. Synchronize to sa kaya ito gagawin.
Ano mo, isa-isa lang. Isa-isa lang.
Sir, ano na natin isa? Pablocking mo na daw.
Detalye.
Bakit tumurok biglang? Nandito po si sir. Yun o, yun mo doon ang turok.
Tutuog muna tapos ano. Ginagawa na isa-isa.
Dok!
Wala na sa sapaw. Photo op lang, kunwari nagtuturok, tapos isa-isa na lang para may detalye.
Kaya isa-isa sa gitna. Pwede na. Okay, gitna mo na, gitna.
Ay, kaya.
Sabay-sabay na yun, pagkaan eh. Sabay-sabay na lahat eh. Kaya nga, sabi ko, sabay-sabay yun.
Doon ulit, isang tanong ko kay Doktora. Ambos. Dok! Ano niyo na to si Doktora? Lagay niyo na rito, tanongin natin. Si Doktora, sir. Ito na si